Good morning. Welcome to the latest edition of our Rethinking Wales series. I'm Oriel Miller, Director of the IWA. We are Wales's leading independent think tank with a long track record of shaping debates and influencing change in Wales through policy research and advocacy, our online and print publications. And here's a copy of the Welsh Agenda that we published in May this year. And we provide platforms for robust comment and debate and our agenda setting events. We're a membership organisation with members right across the country and much further afield too. We're funded by our members, the events we run ourselves, and independent trusts and foundations. A little bit of housekeeping before we get started. It's a Zoom webinar, so unfortunately I'm afraid you're muted by the host. We're going to use the Q&A section on the bottom right-hand side of your Zoom screen for questions. If you'd like to direct your question to a particular panellist, do please state their name. Do please engage with each other through the chat as well. Say who you are, where you've come from, what you're interested in terms of the conversation we're about to have. Please do remember that all chat and questions are recorded. We'll be putting the recording of the conversation on our YouTube channel and sharing with members and others as well. We'll be keeping the event strictly to an hour to avoid Zoom overload. An hour is quite enough. And the hashtag for the event is #Rethinking Wales. This is in fact the 18th Rethinking Wales panel conversation, and we'd really like to thank the National Lottery Community Fund for supporting us in this chunk of the series. Diolch yn fawr. It's also the last in the series for now as we take a break over the summer. Of course, if you want to be the first to hear what's next from the IWA in our event series from the autumn, please do consider joining us as a member, and a member of the team is going to put the link in the chat now. Throughout our Rethinking Wales series, we have reflected on a wide range of topics, always from the perspective of what the coronavirus pandemic has taught us, for better or worse, about the things that we value. We have a newfound appreciation for the places we live, the ways we work, the things that we do to unwind from work, whether sporting or cultural, the ways we learn, whether we're young or old, the public services that keep us healthy and safe, and the community facilities that support our well-being, which perhaps we previously took for granted. But what I hope the pandemic has made us rethink most of all is how we value people. Volunteering is, by definition, time given for free, without a value set by the marketplace. But we've heard through our partners and through some forthcoming research, which I look forward to telling you about in the near future, countless stories of people stepping up, going further, doing more, for no other reason than to help and to make a contribution to their community in this global crisis. For many in our communities, volunteering hasn't just been heartwarming and gratifying, it's been life-saving too. Whether it's neighbours checking in on the person next door who lives alone, to community groups making sure struggling families don't go hungry, to organisers making sure the right messages about how to keep safe can really cut through the noise, through the misinformation, and through the sometimes frustrating politicisation of this crisis. I'm sure we're going to hear lots more of such stories from our panel today, but we also want to ask bigger questions about what we can learn. What has COVID taught us about the infrastructure, both physical and societal, that supports volunteering? Was it as easy to step up and help as it should have been? If not, why not? What could we do to become a society which better supports both those volunteers who have been quietly giving their time for many years before the pandemic, and make sure we're better prepared to mobilise the outpourings of support that we will need if, or more probably when, the next crisis comes along? As ever, we've pulled together a panel who can hopefully give us some answers to these questions, and I'll introduce them in a minute. But we also want to hear from you via the chat. What inspiring examples of volunteering have you seen over the last year, and what helped or hindered them? Please share your own thoughts and experience. So to our panel, and as I introduce them, they're going to kindly put their videos on too. Judith Stone is Assistant Director of Volunteering at the Wales Council for Voluntary Action, the national membership body for voluntary organisations in Wales. Judith looks after the operational planning and delivery of the council and coordinates work with key partners in national and local networks to provide an infrastructure of support for voluntary organisations across the country. Welcome, Judith. Sue Leonard is Chief Officer at the Pembrokeshire Association of Voluntary Services, which was established to support and develop voluntary and community action in Pembrokeshire and provides a working relationship between voluntary and statutory organisations. Welcome, Sue. Kerry Marlowe is the coordinator of the Porthcawl COVID-19 strategy group. The group's been supporting vulnerable people in Porthcawl by offering a coordinated response between professional bodies and over 400 volunteers to deliver food, medication and social wellbeing support to the community. Welcome, Kerry. Glad you could join us. Sue Husband is Director of Business in the Community Cymru. BITC is a business-led membership organisation that works with more than 200 small, medium and large enterprises, helping them improve their responsible business practices and aligning them with local social issues. So welcome to you too, Sue. Thanks very much indeed for being with us today. We're going to hear from our panellists in a minute, but we're also, just a reminder, we want to hear from you. And I can see that people have started saying hello in the chat. Do please keep that going. Twitter, we're going to be on the hashtag Rethinking Wales. You can include questions using the Q&A function on Zoom. And we'll be taking some time at the end of the session to put these to the panellists. To make sure we get through all of your questions, please can you try and get them in before about 11:30, because that way we're not sort of missing something just at the very last minute as we close up, which can be frustrating. So there we are. I think we're ready to go. So Judith, I'm going to come to you first in terms of setting that big picture scene. COVID-19 has obviously really drastically changed who needs help, what helping others mean and how they need help. In your view, how has volunteering changed over the last 15, 16 months and what have been the biggest challenges?
Thanks, Oriel. So I think there have been three main trends that we've seen in volunteering over the last 15 months, and WCVA is part of two significant research studies, the Mobilising Voluntary Action research and also the volunteering, wellbeing and the COVID pandemic research as well. And these reports are telling us three main things. So the first is that public awareness and enthusiasm for volunteering has really increased. WCVA, along with the 19 CVCs, manages a national platform for volunteering called Volunteering Wales. And in March 2020, we saw over 30,000 people sign up to that database looking for volunteering opportunities. The average page views normally around 2,000 to 3,000 a day. And on the 27th of March, they were almost 69,000. So we can really see that that appetite for volunteering has increased. At the same time, the demographics of volunteers have changed. So we have seen a significant increase in working age adults volunteering. So people maybe had more time available as a result of working at home, perhaps being on furlough or being made redundant. We've seen an increase in young people volunteering and people from ethnic minority backgrounds. Also, key workers featured very strongly as well. But we've also seen a decline in people who were perhaps involved pre-pandemic in more formal forms of volunteering. So particularly older people and people with long-term health conditions and disabled people who were perhaps shielding during the pandemic and were less able to fulfill the roles that they had previously. We've also seen that the types of volunteering activities have changed, and really it's illuminated that kind of spectrum of volunteering activity, ranging from formal at one end down to very informal community-based social action at the other end. And we've seen different types of volunteering, so more digital, remote volunteering, more home-based, and very much that mutual aid support as a very key defining feature of the pandemic. I think there's a national directory of mutual aid groups which saw over 4,000 new groups registered. So a real kind of shift in the composition of the demographic of people who volunteer and also the types of activities that people have undertaken. But there are lots of research reports suggesting that the overall rates of volunteering have remained about the same, but there's been a massive change within that. In terms of some of the challenges, I think at the very peak of the demand, right at the outset of the pandemic, the demand for volunteering placements really outstripped the supply of opportunities. So at the start of the pandemic, when some of the more formal volunteering organisations were forced to close their services, pause their face-to-face support, and a lot of those traditional volunteering opportunities dried up really, really rapidly. However, at the same time, there was a significant and rapid growth in that mutual aid support. And so we saw those two kind of things perhaps levelling out. The wellbeing and volunteering research that we've been involved in with the Wales Centre for Public Policy and WLGA has shown some feedback from volunteers who felt frustrated that they really wanted to get involved, they wanted to offer their time, but in some instances they weren't utilised, they weren't contacted, and they felt very deflated as a result of that experience, and perhaps have a bit of a negative experience of volunteering, maybe as a first time. And also the mental health and well-being of volunteers was a key concern during the pandemic, and now as we continue with people working long hours, often in traumatic circumstances and experiences, and that's really shone a light on the need to support the well-being of volunteers.
So there's loads of stuff in that mix that I think we're going to tease out during the conversation that's coming. Sue Leonard, apologies, I'm going to have to use surnames because we have two Sues on the panel today. So Sue Leonard, obviously recognising that the furlough scheme, Judith pulled this out at the beginning, meant that lots of people who perhaps couldn't volunteer previously could then do so at the start of the pandemic, and the other reasons that Judith gave. What do you think were the barriers and the enablers to mobilising this sudden surge of potential volunteers?
Yeah, well, obviously I'm speaking from the perspective of Pembrokeshire, and we're Pembrokeshire Association of Voluntary Services. We're one of the 19 county voluntary councils across Wales, and Wales is really unique in having that intermediary third sector infrastructure, and each of the CVCs does have a well-established volunteer centre and staff that are used to and experienced in working with volunteers. But what we did see during the pandemic, as Judith has outlined, was that we had about 600 volunteers registering on Volunteering Wales, wanting opportunities just at the exact same time as most formal volunteer opportunities were closed down to us. So we did manage to place quite a number, but it was a challenge. And we had in Pembrokeshire alone 96 mutual aid, good neighbour scheme type groups, informal volunteer groups, 96 of them established within the first couple of weeks. So we had to mobilise very quickly to support those groups, and they nearly all of them signed up to the Pembrokeshire Community Support Network. We had regular Facebook. We had a Facebook group, we had regular weekly Zoom meetings, and we had to work really quickly to support those informal groups. And many of those volunteers, as Judith has said, a completely new demographic of volunteer. Many of our our traditional cohort of volunteers were older, were often shielding, and people who were furloughed, people of working age, did come forward to volunteer. I think in terms of enablers, having the support there through the CVC and having the digital capability of being able to engage online, that of course was a barrier to some people, but for many, particularly those who were furloughed, perhaps used to using IT in their work situation, that was an enabler. So being able to connect digitally and work with those groups digitally, without that would have been a huge barrier. So that, using digital technology to engage was definitely an enabler. I think people who were furloughed, who came forward to volunteer, I think, perhaps some slight difference in expectations between, getting used to not being in a paid role and actually it being a volunteer role. But, I don't think that was too much of a barrier. Just a difference that people had to get used to. So I think the being that new cohort of volunteers. I think we'll probably talk later on about the challenges of actually retaining them as a volunteer, as a volunteer force, will be the challenge going forward.
Yeah, let's come back to that. Kerry, so we've heard from Judith at a sort of pan Wales level. We've heard from Sue at a sort of county CVC level. You're one of the organisations at a community level, and you started the Porthcawl COVID-19 strategy group in early March 2020, when more people were started to be available to volunteer. Tell us about the beginnings of starting things, and those sorts of challenges and opportunities that you faced as a volunteer and as a coordinator of the group, because you've got 400 people in that group, haven't you?
Yes, I did, yes. Welcome, everybody. Yes, when the pandemic started, I sat back and looked at what was required from a volunteering basis, but more obviously focused on the client group. But how many volunteers would I need? What would they be doing? And how was I going to get them to volunteer? I'm fortunate that I run two of the biggest Facebook pages in Porthcawl, with over 14,000 members. So it's easy to get information out. So what we did with my tech guy that I use for numerous other projects that I run, we set up a website and we put a volunteering page on the website. And then we put that across Facebook. Now, the volunteering page had specific information. We split our volunteers up. Our town is split into 5 political wards. It wasn't done on a political basis, it was just built on 5 different areas that we could coordinate the response in those areas differently, because some areas, the area which I live in and the one alongside me, predominantly people are over 65. So there's going to be more impact on volunteers for those areas. So on our website, we put our strategy out, how we were going to deal with the community and the issues we were going to do. And we put a page up so that people could sign up as a volunteer. On that page, they had to put obviously their address, so we could identify the ward that they were in, so I could allocate them to that ward. In addition, we put up whether they'd had any DBS checks as well. And within days, I had hundreds of emails registering. So obviously I set up a register. I appointed managers for each ward. So I had a pharmacy manager, food manager, social contact manager. All of these were part of the strategy I'd already written anyway, before we put it on the website. So then they were allocated the volunteers. But to support the volunteers, we looked at 3 areas. Food, first of all, who can assist with food? So please volunteer for food. Who will assist with pharmacy? And who could assist with social contact? Like some volunteers who were shielded would not be able to go out. So I had a number of volunteers who weren't happy that I put an age group that if you're over 60, we didn't want you doing food shopping, we didn't want you doing pharmacy collection, because you're putting yourself at risk, and we were causing that risk. So from the outset, we said no, but you could volunteer to be a social contact, to support people who are lonely, to have somebody to chat to, and so we set that out. So each manager had a cohort of volunteers with different roles, and each volunteer was given specific instructions of what that role was. So I'd written out a role specific guidance sheet, one to ensure security. So with our social contact, it was always through a password, which was designed by the client. And similarly, with delivery of food and a pharmacy, we had ID badges so that people were identified. In the wards, the client group were aware of who the manager was. Generally, I encouraged local councillors to be managers, but other community leaders that are well known. You know, I'm not a councillor, but I'm quite well known in the town for the many events that I run. So they had somebody that they knew by name, but perhaps never seen before. My phone, or 2 phones, were always available. They could always phone me, email me, WhatsApp me, whatever. So I planned the enabling side of it before we actually put it out, so that it would reduce the barriers to that. Some of the barriers that I hit, I had people question us about DBS. I went straight to WCVA. I can't remember the gentleman I spoke, he's a very senior figure there. And I discussed it with him, the issues of DBS, mainly because our volunteers weren't entering homes. They weren't, although they had personal details because they were phoning people. But if I deal with social contact initially, if there was an issue that cropped up in social contact, they were to report it to me immediately. And I had retired social workers on my list of volunteers who were there to give that extra support. But we also then, I'd linked those ex-social workers and nurses, sorry, into our medical centre, our social services departments, and the police. So I had a strategic group which I set up right from the outset, so that any issues like that we could link in, and that became quite important as we developed with some of the older people that required that. For food deliveries, we wouldn't take any money, so we had to think of a system to sort that out, and that was one of the barriers we had. There were no shops or stores in Porthcawl where you could order food online.
Okay.
None whatsoever.
Major.
So we set about working with the business community, showing them how they could arrange things over the phone, which we did. And we set up another Facebook page and on our website called We Deliver Porthcawl. And that's
so Kerry, I'm going to just move on to Sue for a minute, because there's lots of what you've said I want to come back to and unpick a little bit more, because it's fantastic examples. But you just mentioned there about links with the business community, because I can see how that the food delivery stuff would be just a major worry straight away. But a couple of things that I want to pick up on for when we come back is you were clearly an organizer anyway, and you knew what you were doing. So I want to ask you, how did you know what you were doing at the beginning? How did you know what you needed to do at the beginning? So I'm going to let you think about that while I go to Sue.
right.
So Kerry was talking there about links with the business community, linking in with the police, linking with different public services as well. And what we have all seen is how the pandemic has intensified for stronger links across businesses and communities. And you launched BITC's National Business Response Network to identify precisely this kind of thing, what communities across Wales needed, and match them to the right business support. And tell me a little bit about what that campaign highlighted, please, and what kind of best practice that you could share.
Of course, and I think the first thing to say, this was like a national campaign, but I am in awe of people like Kerry who are able to do things at a local level, and I think the two things have to complement one another. So that's the first thing I'd say. Phenomenal response. So our members actually said to us right from the outset of the crisis that they wanted to help, and they were asking us to find a way to enable them to help in the best way. I think at the start of the emergency, what our businesses were being asked for was actually items. So whether it was food items, toiletries, PPE. So those are right at the beginning, the emergency. But there were also asks coming from charities who are supporting the most vulnerable for skilled volunteers. So particularly the sort of skills that Kerry's highlighted, so like project management, being able, the logistics, how the technology that you can use to connect people and how you can get the right information out to people. So I think in the very early days it was those real professional skills to help charities to potentially adapt to doing things online. And I think the campaign highlighted a few things. it really struck our business members that there were individuals that were really close to tipping point, and some of those in work, and how quickly they slipped into needing emergency support. I think for many, it was the first time that they'd needed that emergency support. So again, they weren't able to navigate the system as well as some who may have, used that before. I think for businesses, it highlighted how much businesses, but also their employees, really wanted to help. But if they hadn't volunteered beforehand, they just didn't know how. And I think people always assume that when you volunteer, it's about just all hands on deck. And actually, I think with this crisis, there have been very specific skill sets that have been needed. So I think it was highlighting to them that they may actually have professional skills that they can volunteer rather than just, mucking in. And then I think, we saw that with the businesses that we did work with, they really valued the support that we were able to give them to match the skills that they were offering to the requests from charitable organisations, sometimes very local or very new, that they hadn't connected with before. And I think the last thing it highlighted for us was the gaps in provision and support, and the really significant role that voluntary services were already playing in Wales. I mean, there is an over-reliance now, we know. So, that's definitely something we need to consider. And then the impact on those services. So, they've been in more demand than ever. And actually those individuals who are already volunteering their time, the pressure that they've been under that has just been constant throughout the crisis. And I guess in terms of best practice, I think what we've actually seen is that if we can really smartly match the offer of help from a business to a charity and get a relationship formed, it goes from being a one-off bit of volunteering or professional skills offered to actually something that can be nurtured. So for the business, we need to understand their purpose and what they've got to offer, and for the organisation, they need to be able to articulate what it is they need or what the problem is they're trying to solve, because they might not know what they need. And by that, I'll explain that we've worked with some charities that didn't think they needed an app, for example, and Safer Wales is a good example of that. But through working with AXA PPP, who'd been doing some other work with them, they identified that if they could produce an app for Safer Wales, it might help them to better connect with those vulnerable people they're trying to support. So, I think the biggest sort of lesson for us is think carefully about the business, that you're matching with the voluntary organisation, and really work hard to nurture a longer lasting relationship.
So there's something in that, Sue, isn't there, about kind of the connective tissue between different types of organisation, and somebody who can both identify, articulate and explain what the other kind of language means in that particular situation, which needs to be resourced in a different way then going forward, because that sounds as though that's a lot of the role that BITC played in that particular situation. Judith, I'm going to come back to you around, and Kerry, you're up next, so just a heads up for that. But in terms of how organisations like Kerry's played such a pivotal role, especially early on in the pandemic, when statutory services were kind of, there's a whole heap of stuff to work through. How can we all make sure that groups like Kerry's are resilient for the future? Because we're going to need each other again. No matter what happens, we will need each other again. Judith.
So talking from a kind of infrastructure perspective, WCVA at national level, CVCs at local level, but also many other intermediary bodies, we have a big role to play here in terms of recognising that our traditional audiences are changing and evolving to encompass a larger proportion of groups like Kerry's that maybe we haven't historically engaged with, and hopefully have done more of that through the pandemic, and the importance of linking those organisations into other networks locally and nationally that complement and build that resilience around that group, but also having that direct relationship with mutual aid groups to help them with information, guidance, advice, training to help them grow and develop and evolve in a way that they want to, that meets the needs of their locality and the wishes of the people who are involved. And that can be anything to recognising an initiative has reached the end of its life and needs to close down, through to evolving and growing into other forms, perhaps having a more formal governance structure. So there's lots of support that needs to be tailored to that kind of new group of organisations, to help them to grow in a way that they want to.
Okay, thank you. So Kerry, let's just pick up on one of the questions that's come through in the Q&A thing is from Adrian from Trevi, Cymru. Hi Adrian, nice to see you here. That you obviously played a really crucial leadership role, and we could spend, I think, the next half a day at least talking to you about how that worked and what you did. But really interesting question, which is what was your role in Porthcawl like before the pandemic? So tell us a little bit about that, and then I want to pick up on what you're thinking about next, and picking up on some of the things that Judith has been raising.
Okay. Well, within Porthcawl, I've been heavily involved in the community in various guises. I set up a charity for sport and developed all our sports facilities here over 20 years, and then I resigned from that and let other people hand on that. I've run our Porthcawl Carnival and our Porthcawl Christmas Swim. I'm a director of both of those. I've run them for over 30 years. Okay. So my skills were about organisation. The two main events I just talked about now, the Porthcawl Carnival, Porthcawl Christmas Swim. People used to think I had a huge committee. No, I didn't. There were 4 of us, but 4 workers, not people who sit around and talk. I'm not into talking. I'm into doing. Let's get it done. And I'd rather people working with me who could do that. So I've got a small team of people that I know I can rely on. A technical guy, a health and safety guy, those kind of people who can advise me appropriately. But yeah, that's my skill set. My working life, I was an organizer, a manager, and a leader. In my working life, I dealt with emergency situations on a regular basis. So if something came in, I had to have that ability to say, right, we've got to do this, and this. And I'd learned, if you remember 3 years ago or 4 years ago, we had a terrible weekend of snow. Well, we are an isolated community in Porthcawl. So when that was forecast, I actually set out a strategy to deal with that. To support the vulnerable in the community. Unfortunately, we were seen as such a useful group that Port Talbot, Neath, Swansea, Cardiff, Pontypridd were phoning me for assistance. My phone was non-stop for 36 hours. And that wasn't going to happen again because I couldn't cope with the amount of work. So that's why I set it up as I did, because I realized I needed to devolve management issues to other people, but I need to make sure that they knew what they were doing. So I actually wrote instructions out for them.
So there's a little bit of experience in that mix. Trusted contacts also in that mix.
Yes.
Clarity of the roles that people needed to play, and the fact that they too had played those roles previously. So it was flipping it into a different context, but doing what they knew how to do. Yeah. And then also a bit of thinking ahead and seeing what was coming and thinking, oh, I think we're going to need to use this, but do it differently. There's a question here, I think, for Sue Leonard, please, next, which is, how do we find more Kerrys in other towns and areas? Do you know the Kerrys in Pembrokeshire?
I'd like to think that we do, and certainly a lot of Kerrys came forward during the pandemic, and I think our challenge is what kind of support do we need to provide and assist, just so that people can continue if they wish to do so. And I think that challenge about actually do we need to always have, do we need to exist in a permanent state of crisis to get the surge of volunteers coming forward? You know, that's, you know, when we consider that actually we've had COVID and the response has been absolutely magnificent, and a lot of community spirit has been rekindled through the crisis, despite the fact that we've not been able to meet face to face and get together. You know, I think community spirit has been strengthened in many places. It may also have shone a spotlight on gaps and where, you know, those relationships don't exist in communities. So I think, you know, that might also have happened. But, you know, in terms of moving forward, you know, there are always crises to respond to. We know mental health crisis, climate change emergency, we have nature crisis, loneliness and social isolation. These are all things that are sadly are around us day in, day out. There is so much that you know, volunteers can do to assist in all of those things. And so I suppose our challenge is, how do we work with people like Kerry and the, you know, and all the volunteers that have come forward over recent months, to help them find ways of continuing to give of their time. Even we know that sometimes, you know, people are going back to work now, they don't have quite as much time to give, but we need to make it possible and easy for people to give whatever time they can afford to give to benefit their communities and you know, the people that they're living alongside. So you know, I think looking at different forms of volunteering, not putting barriers in the way, where you know, what did happen in the crisis is that we became solution finders. Everybody was just able to find solutions and act quickly. So, you know, that's not about throwing safety and safeguarding out of the window, but it is certainly about recognizing that people in communities where there is trust, where people, I think Kerry said, you know, find the community leaders, people who people trust. The role of town and community councils in all of this is absolutely critical, and building those strong links with our representative democratic structures at that local level, and linking that to the participatory democratic structures around volunteering. That's absolutely vital.
So there's loads in that mix. I want to pick up on a few things, and I guess these are questions for you, Sue, and Judith as well. One of them is around the sort of gap analysis of spotting where isn't covered or where isn't covered quite as well because of either the demographics of that place or the location or the isolation of that place, and what is being discussed for sort of the next stage. So Judith, I'm going to come to you on that in a tick. I think there's something also, Sue, Leonard, about what you talked about there around, you know, how we talk about these various issues and the labeling of them as crises, because people don't experience them according to a label, do they? None of us do. It's a label that's put on either for policy or funding purposes, and often it's around raising public awareness and mobilizing that action to address whatever that issue is. You, as a CVC, you're working alongside local authorities. You're also working alongside community groups, and you and I know we're both on a call with New Local a few months ago now, probably, talking about how local authorities right across the UK need to work very differently with these new groups of volunteers, given that the priority from their perspective will be for statutory services, and volunteers often fill the gaps, as you said, in these. With the pressures on public finances going forward, not abating at all, can you tell me a little bit about how you see that sort of newfound recognition and respect for the organisation and the performance of these local performances, how they've operated, whether you see that continuing from a local authority perspective, or do you see that as kind of job done, right, we're back on it, now? How do you see that? How do you see that shift?
Well, I really, so speaking from a Pembrokeshire perspective, I'm pleased to say that even before the pandemic, there was a growing recognition in the local authority, particularly, I guess, in kind of social care and housing, that kind of, and also with the health board and other partners, that actually, you know, communities, in terms of prevention and early intervention, that communities were absolutely fundamental to that area of work. So for about 5 years, at least 5 years, we've worked as a sort of preventions partnership, and the investment in, you know, volunteering communities, that sort of, you know, is there, and the recognition of what they could do was there pre-pandemic. During the pandemic, you know, the communities have really come to the forefront, and I think they've demonstrated just the power of communities, you know, what people can do when, and also looking at asset-based approaches. So, you know, people are assets. Kerry described, and Sue described very clearly, you know, that people themselves have skills and experience and talents. And actually, we found in the pandemic, you know, when we had an issue with volunteer ID cards, there was one person in a community that solved it, you know, well in advance of any national solution coming down about volunteer ID cards. So, you know, people, communities are full of assets. And when you start to unlock those assets, working closely with people in those communities, that's when you start to see a real shift. And I think we're still a little way from seeing that real shift in community power, but that commitment to co-production, to asset-based solutions, to it is that, you know, participatory budgeting, so that communities have funds that are available to them that they can invest in ways that make sense to them. And, you know, I think all of this, we need to start really living and breathing it now. And the excellent publications that New Local have put out, where it shows that paradigm shift from that state model to the community power model. Yeah. We need to look at that and start living and breathing it. And I think that, you know, local authorities are up for that now.
Good. We'll watch with interest. I'm going to pick up on a couple of things you said there about connecting in with local democratic engagement as well, and what community voices and, you know, what people want. It's interesting to hear participatory budgeting coming back in, because I was talking about that 16 years ago with one of my first jobs in Wales, and it's like, here we go again. You know, actually we know from the evidence how important that is. We just need to shift the funding to enable that to happen. One of the things I'm going to ask Andy to put in the chat now, though, is a link to a charter, a Welsh Places charter that we have coordinated and convened with a bunch of partners, and talking about how there needs to be a fund for communities to have their voices heard around issues that they want, projects that they want to work on, of whatever shape and form. There are more details in the charter, and it's coming up in a tick. But again, to shape the future of their place in the way that they want it to be shaped, whatever that issue is, through town and community councils. I'm going to just come to some of the questions from the people in the audience now. There's a question here from Gethin Rhys of Cytun. Hi, Gethin, croeso, which is Churches Together in Wales. Many people help out their neighbours, or started doing so during COVID, without thinking of themselves as volunteers, in inverted commas. It was just a human response. What sort of dangers do you see in seeking to both categorise and systematise a basic, good, human, very human instinct to help one's neighbour? Gethin, obviously, as a Christian, would say to love one's neighbour. Kerry, can I come to you on that? Yes. Isn't this something very natural?
Yes, we all like to help. Unfortunately, we have those in the community who will abuse that. And one of the things that really annoyed me was when the pandemic came out, and all the main TV programs were putting up, fill in this little card saying you needed help and put it in your window. That was open to criminal abuse beyond belief. There was enough scams going on anyway. And the problem you get is if somebody's vulnerable and you've got somebody in the community, you can see that they're vulnerable, they will take advantage. So you need to make sure that things like that do not happen. And that was part of my strategy, that we would not, you know, if people were volunteering and saying that they were helping neighbours, we asked them to come to us and be part of our group. You know, if they, obviously if they're a neighbour, they knew who the neighbour was, but sometimes you can't trust your own neighbours. So at least we had an idea who they were. And if I had any doubts them, I could run it past the police and say, can you check these people out for me, please? Which we did. You know, some people were a concern to us. So you have to be careful, particularly in a town like ours, which we've got a high population of older people who become very vulnerable to smooth talking people. And so we were conscious, and we printed leaflets for every client that we had, and we delivered to them and said, look, if this happens, you're to phone me. You know, and you know, even with some volunteers, they still phone me and say, "Oh, I wasn't sure about that volunteer," and I said, "No, that volunteer is fine." You know, but I'd rather them check than be conned.
That confidence and trust is super important.
I think we said confidence and reassurance was key to supporting the more lonely and vulnerable in our community. You know, it is easy to con somebody, and we just wouldn't allow it. So we wouldn't take money off anybody. We wouldn't take cards. You know, people say, "I'll give you my card. Will you go and do my shopping?" No. We wouldn't do that. You know, and we said if anybody did that, they would phone me straight away. I'd immediately link it in with the police. That was a more formal strategy group. Yeah.
Sue, you're putting your hand up, and I think this is also playing to John Galander's question around, you know, a danger of potentially over professionalising volunteering at the cost of good neighbourly responses to support people in the community.
Yeah, and I see that, and that the last thing you want to do is dampen that enthusiasm. I just think from the view of a business, so when we're trying to get businesses to engage their community and to volunteer, what we've seen is that whilst they really want to do more, they do need that structure. So I think from a business getting their employees to volunteer, they prefer it, you know, when we are able to help them to structure that volunteering. So the best example I can think of for, you know, the future is we're looking at the impending, I suppose, what could be the employment crisis, and working with our businesses to help support them to train up their employees to volunteer to be job coaches. Just do a handful of sessions with an individual that just needs some additional support. And I think for businesses, they will always revert to what's the safe way for me to do this in a controlled manner that I can really define what it is that we're doing. And I think that needs to sit alongside, you know, an environment where we're absolutely encouraging the sort of work that Kerry is supporting in Porthcawl. So I think the two can sit alongside one another, but for businesses, I think there will always be that need for structure.
So thank you, Sue. Judith, I'm just picking up on some of the comments in the chat before I come to you. I know that Ian Thompson from the Fan Charity is here talking about how they've switched to a very virtual approach, and now the challenge is to move forward in a hybrid fashion. So maybe you could talk a little bit about that. Hannah from WCPP, the Wales Centre for Public Policy, has shared a link on the piece of work that they did with WCVA on the role of communities and technology in mitigating loneliness in the chat. Fran Target, chair of the WCVA Help Force Cymru, talking about the framework for volunteering in health and social care, which will be being published next week, and put a link on there. So thank you, Fran, for that. Peter Cox, in terms of work that he's done with the co-op around various iterations around local food delivery, phone systems supported experimentally, then a UK-wide thing. So great lessons for businesses there in terms of how that online ordering for small grocery provision started with a bunch of volunteers in Cardiff. That's a really good example to pick up on. And Chris Buchan from the Welsh Government Communities and Third Sector team about the plan for a fair, green and just recovery, and a link in the mix there too. Can you talk a little bit, Judith, around how capturing the lessons, but also turning those lessons into next time at the very basic level, these are the do's and the don'ts for a start, but also this is what we need to have done before we get to needing the kinds of outstanding support and coordination that Kerry has illustrated so powerfully for us all.
So I think at the moment we're very much in a phase of enabling that sharing of information, insight, learning, experience, and this is a fantastic way of doing that. But also we launched at WCVA on Friday at the end of our Voluntary conference with funding from Welsh Government, Volunteering Wales strategic grants, which is providing some small amounts of funding to enable that active learning and dissemination, sharing, upscaling of that good practice, those new models that were developed to spread them, learn from them more, and then think about how we move those forward as we go through the process. We're also working closely with Chris Buchan and his team at Welsh Government to establish a cross-sectoral leadership group for volunteering at national level, which will we very much hope help to mobilise across the sectors. You know, there's so much potential within the public, private and third sectors to do more, to do it better, to do it in a more coordinated way. But we really need that kind of strategic oversight to think about the best mechanisms that we can employ, the levers that we can pull to support that activity going forward. So I think at the moment, you know, with a big role in dissemination and facilitating that learning, and then distilling that and thinking, okay, what concretely now do we need to put in place to hardwire some of those really great changes to the way that we work and live into our practices in the future.
And I think there's two, that's really useful, thank you. I think there's two things to pull out of that. One is around flexibility. So Fran was saying in the chat just around how, you know, at appropriate levels of checks and bureaucracy needed to perhaps be relaxed a bit at the beginning to enable things to get going, but now need to be sort of, oh, actually, this is where we are. This is where we are. So that's one thing. And then also a really great challenge from John Galanders, which is that the balance between the support that may be needed for kind of pop-up projects that are time limited and the enthusiasm that's been generated from volunteers that Kerry has mobilised versus formalising these activities to a point that negates enthusiasm because it becomes a thing with rules and stuff. So I can see Sue Leonard nodding. So Sue, can I come to you on those, please? That sort of flexibility, and then let's not put things in boxes too much.
I think it's really important. It's about getting that balance right. We need to be there to facilitate and support and ensure that people can help each other safely. But we don't want to be putting too many barriers in there either. I mean, again, from a Pembrokeshire perspective, what we've learned over the past during the pandemic has really accelerated the pace of change and the development of new local infrastructure around what we would call active citizenship. So that's everything from the very informal volunteering groups right the way through to very formal volunteering, and then through to representation on town and community councils. Often those active, you know, leaders in our communities, you know, they'd be great to get onto the local town and community councils. So looking at the whole continuum of active citizenship, We're continuing with our community hub that was established as a COVID response. So the community hub is now going to be part of the infrastructure. We've got a volunteering for Pembrokeshire brand and strategy that was developed with some funding from Welsh Government. A renewed commitment across PSB partners to look at employee and employer supported volunteering in their
Public service boards, for people who may not know what PSB stands for. Yeah.
Sorry, public services boards, yes. You know, we're looking at things like volunteering passports so that volunteers can volunteer for a range of organisations. We're looking at digital volunteering, micro volunteering. So, you know, I think what it's really made us do is look, and also digital, you know, how we use digital technology. So, you know, we're building a stronger, more collaborative infrastructure around active citizenship, and I think that's, you know, really all the we've got a Connect platform that's actually looking at person to person time banking. So, you know, we're looking at all of those infrastructure things so that we can hopefully continue to support the very informal through to very formal volunteering, and in a way that can flex up and down depending on need.
Thank you. That's a really great set of examples all in one place, because I think some of that stuff existed previously but wasn't necessarily conceived under the same umbrella. I know we've got people from Innismore, from Wrexham, from Pembrokeshire, from Cardiff, from the Valleys on the call today. So if you want to share similar experiences on the chat, do please do that. But it sounds to me, Judith, as though you definitely need to plan a volunteering specific conference sharing opportunity in the next year or so to make sure that is both assimilated and shared out more broadly. I'm conscious of time. I wanted to just flag Anna Jones, who is the Civic Mission and Sustainability Manager at University of Wales Trinity St David's. Welcome, Anna, nice to have you here. Who's interested in how to encourage students into volunteering to improve their life skills, recognising obviously that employability massive issue that we're going to have shortly, looking for tips and making connections. And I know she's made lots of connections in the chat in response to her question, but maybe other people can share some insights in the chat as well. I think we are okay. Here we go. One more question here. Great question from Emma Taylor Collins. What do we know about communities or groups that volunteering hasn't reached during the pandemic? Are there gaps in terms of who has and hasn't been helped? So, Judith, can I come to you on that? You've got your thinking face on.
Say it again. So
what do we know about communities or groups that volunteering hasn't reached during the pandemic? So that gap analysis I was talking about, Emma articulated it really well.
Yeah. When you were talking about gap analysis, I was thinking, you know, there's multiple dimensions to that. One is of a community of place, and one is a community of people. And actually, I've just returned from a secondment. I was more on the front line in the pandemic at running a national charity, Kidney Wales, where we were supporting a community of interest, which is about 3,500 end-stage renal failure patients. And I think it's about, you know, using this, you know, we've got over 35,000 voluntary organisations in Wales who all have been established for very specific reasons to support places and communities of interest. And I think it's about understanding that those charities have the ability to reach people who need that help. But in terms of thinking about, you know, examples of where volunteers haven't reached people, I can't think of any off the top of my head, but I may not be the best person to ask. Maybe Kerry is better placed to answer.
Well, thank you for doing my job for me in terms of the segue. No, it's great. I love it. Happens by itself. Kerry, my first, while you get yourself sorted on the volume, brilliant. I guess my next question is, when are you going to stand for your town and community council? But we'll watch that. That. Well, we'll pick up on that. Why not? Another time. But what about communities that haven't been reached by volunteering?
Well, I was contacted by a number of other communities across the UK because I can't remember the gentleman I spoke to in WCVA, but he asked me for my strategy, which I sent to him, and he circulated it. Well, I had 29 similar towns who followed the strategy I set out, who were in regular contact with me about how do you do this, how do you do that. So I was actually circulating what we were doing.
Fantastic, well done.
Now, some of the problems that some of them had was that, perhaps this links to your question about whether I should be a town and community councillor, was that town and community councillors would intervene and say, no, we don't want to do it that way. Whereas we'd already done it and it was tested and proved. And I said, well, what right have they to say not to do it? You know, going back to gap analysis, I did a continual gap analysis on a weekly basis to identify future problems. So our future problems were opening shops. Yes, we'll deal with that. But how do we get the people to the shops? So then we did community support. So we put people with the elderly to take them shopping. We had schools problem. They needed computers. So we addressed that. You know, and what we've done is that our strategy's been dynamic since we started. So whatever I foresaw is going to be a problem, because I walked myself through everything and thinking, what's going to happen next? What's going to happen next? I address it with a strategy, discussed it with my management team, and then we put it in place. We were putting things in place before the Welsh government came out with things, before the British government came out with things, and we were dealing with it, even down to signage in our towns, keeping distances, you know. So some of them didn't work, obviously, because it never happened, but you know, we had put things in place just in case, you know.
Judith, thank you. Very quickly, Judith, because we need to wrap up.
Yeah, I've better thought of my answer now. I think there's work to be done on how we involve people just like Kerry more effectively in local resilience fora. You know, they're kind of statutory fora primarily, but now we've got this huge cohort of local, hyper-local intelligence in the form of people like Kerry, who really need to be linked in to those fora, so that they can contribute more effectively and more quickly to emergency responses in the future.
Okay, thank you. There's some more questions coming up and comments in the chat. Do please keep those going while I just wrap up. I just want to say thank you very much indeed to everybody for joining today's conversation. I really want to thank, first of all, the panellists, Judith Stone, Sue Leonard, Kerry Marlowe and Sue Husband, so Jochen Bauer, everybody. Thank you also to the National Lottery Community Fund. It's the fourth in a series we've done in partnership with the fund, always looking at community-focused issues. We've looked at relationships and friendships between people with learning disabilities and how the pandemic has impacted on those. At inequalities in community sport, as people seek to use sport to improve their well-being, at banking for the community as well, and today at volunteering. Our aim in these open events is always to identify issues that need further thought, articulate really clearly what those issues are, and get people thinking about what needs to change and where that change should happen, why that change should happen to, and also how, so that we can all play our role as active citizens in making Wales better, which is the IWA's mission. If you want to receive early notifications of future IWA events and recordings of all of our Rethinking Wales sessions direct to your inbox, so you can sit down and watch them or listen to them while you walk the dog, without having even to go and look for them anywhere, please do join us as a member, and the link will be in the chat in a tick. By doing that, you can play your own role in supporting an open, politically independent organisation at a crucial juncture for Wales. We have many collective challenges ahead of us, and one of the things that we want to do is try and make those connections between those different policy areas. Thank you very much indeed for attending today's event. I've gone on beyond my time. Although we are wrapping up for the summer, we've got loads and loads of really exciting projects and events run for and planned for the autumn and beyond. So do make sure you stay in touch with us, either by signing up for our newsletter or on Twitter. Diolch yn fawr, everybody, and see you soon. Thank you.